Getting over or on top of a high obstacle is a more advanced skill. This is most commonly used when you come across a curb or single step without a curb cut or a ramp. It is quite acceptable to ask someone for assistance in this situation, although it is important that you provide them with accurate directions on how to assist you safely and effectively. We will go over how to get up a high obstacle with assistance. There are several potential risks with getting up over a high obstacle. If your casters strike the obstacle and the chair stops suddenly, you could tip forwards out of the chair. If you are only able to get one caster over the obstacle, or they land at different times, you can have a sideways spill. If both casters make it up over the obstacle, you should also be cautious of a backward tip. Caregivers should also be careful about potential back injury while performing this skill. Ensure that any rubber or plastic grips on the push handles are secure and will not slip off, as this could create a tip or fall. Depending upon the height of the obstacle, you can approach it either forwards or backwards. The higher the obstacle, the more difficult it becomes to use the backwards approach and the greater risk for injury to the caregiver. We'll go through both options. The forward approach is the preferred method. Wheel your chair close to the edge of the obstacle. The anti-tippers may need to be moved into the up position or removed depending upon the height of the obstacle. The spotter should push down on the tipper bar with one foot and pull back on the push handles to raise the casters off the ground. In this wheelie position, push the chair forwards until the front casters are resting on the obstacle and the drive wheels are right up against the curb. The wheelchair user should shift their weight to the casters by leaning forwards and may grab a hold of the push rooms to assist with pushing. The spotter should push the chair forward and upward, rolling the drive wheels up and over the obstacle. The caregiver should not try to lift the chair up onto the higher surface. They should stand close to the chair but be careful not to use their hip or knee against the back of the chair, as this can be uncomfortable for the user. The backward approach can also be used if the obstacle height is small but presents a higher risk of injury for both the user and caregiver. The anti-tippers will need to be moved into the up position or removed. Turn the wheelchair so it is facing away from the obstacle. The caregiver should push down on the tipper bar with one foot and pull back on the push handles to raise the casters off the ground. The caregiver can then wheel the chair backwards until the drive wheels are right against the obstacle. Using a backwards and upwards motion, the caregiver should roll the drive wheels up and over the obstacle. Roll the chair far away from the edge and then lower the casters onto the higher surface to avoid a forward tip. Return the anti-tippers back into position. Press Next to continue.